Most interesting things that I've seen, Cheryl, is a bit of a change in direction in terms of the bed discussion, especially in South Muskoka. Can you kind of give us an idea of where that is at right now and what that overall means in the planning process?
So over the past few weeks, James, we've been listening attentively, and from our community as well as our credentialed staff and our other stakeholders. And there, continues to be a concern about the distribution of the beds, and it comes up time and time again.
Mm-hmm.
And so we've been working with that listening with our consultants and our project team, and we've been looking at what opportunities, albeit it's a tight corridor of what we can do to try to adjust that, and try to get maybe better alignment with what we were hearing from folks. So we wanted the community and folks to know that we were listening and we're open to making some adjustments if we can do that. And that was really, we wanted to get that out in front of the meeting with the physicians so people knew that we were coming to the table. This is not a negotiation necessarily, but we're listening. And so I was really optimistic with the discussions last night, and, the opportunity to go through what that complex planning process and parameters are. That we have to go through planning hospitals. So I can share a little bit more of that when you want to hear about it. But
Yeah.
it was really the reason. It wasn't that it necessarily came out of left field. That's what we've been hearing about, and we've been trying to work on that to see how much, for lack of a better word, how much latitude or wiggle room we have and still stay within an affordable budget, still first and foremost develop a healthcare system that's going to deliver high quality care.
So the question is, Cheryl, if we move forward with this plan of having more beds in Bracebridge than was originally proposed in this plan, does that mean you'd be taking beds away from Huntsville? Is this a redistribution of beds, or is this an addition of beds?
No, it's exactly the first point that you made. It's a redistribution of beds. We have 157 beds to work with. We also have, that notion that we want to build centers of focus for all the reasons we've talked about before. So
Mm-hmm.
we're trying to balance the essence of that type of services in a hospital to how many beds we need
Okay.
and what services do we need where. So we can't go any higher than 157 beds. That's what was in the approved master plan.
Now, my other question to that is, do you know at this point how many more beds we could be seeing in Bracebridge? And again, I'm outlining that this is just a proposal right now. These are just discussions that are happening. But is there a number attached to this at this point, or are discussions still ongoing?
Yes, discussions are still ongoing. James, we left last evening with a few queries that we want to continue to work on with our consultants, crunch some more numbers, and then we'll be circling back with the physicians based on that.
Cheryl, not to put the cart before the horse here, but I'm wondering, is there a potential that we could be seeing in these discussions more of a balancing out of this bed situation and services as well between these two sites?
We do support, and I didn't hear any disagreement, and I haven't actually through this process, that realizing that our healthcare in Muskoka for the future, in order to be sustainable, in order to be able to provide high quality care, we have to look at doing things differently
Mm-hmm.
and not just exactly the same in two sites.
Yes.
And so we're trying to keep the essence of that concept of having centers of concentrated services, focused care, centers of excellence, whatever people want to call it, concentrating services. We want to keep that at the core, and how do we then build the beds around that? And so it, we still want to try to keep with that
Sure.
approach. And I didn't, again, supporting the conversation last night, it was really about not necessarily just equalizing things. I think the conversation went to how can we distribute the beds so that people can provide the inpatient acute care that they think they need.